Welcome back. Cybersecurity, a key issue for companies across all industries, but there's one sector that seems to be falling short: healthcare. My next guest company helps keep patient data safe at some of the country's largest healthcare systems. Joining us right now is Imprivata CEO Omar Hussain. Omar, good to see you.
Good morning.
Thanks so much for joining us. First, tell us how Imprivata works in terms of protecting people's data.
Well, we provide solutions that protect access to patient information. So one of the big challenges is that how do you allow providers to quickly and easily access patient information, but do it securely? And so we provide biometric solutions that allow, and smart cards and other technologies that allow providers to basically tap a badge. We know who you are. We can give you the information you're supposed to see.
Because on the one hand, you want to have that sort of convenience of having everything digital, but on the other hand, you don't want to be vulnerable, that anybody can get your health care.
Exactly. You're hitting the big nerve in the healthcare is that people don't want security because doctors and nurses think it gets in the way of providing care. But at the end of the day, there's enough technology now that you can make it so simple that you can protect patient information. You know, the scary thing, Maria, is that if patient information gets out, you can't replace it. You know, you have a credit card transaction and you go, someone steals your credit card number, buys a TV, the bank replaces it for you.
Yeah.
But let's say you're getting treated for something and someone finds out about it.
But how do you protect it? I mean, is this encryption? Are you putting this on top of the format that?
There are three ways, right? How you the patient information is encrypted in the database where it's stored, and then in the care providing process, there are three things clinicians have to do. They have to access patient information, they have to do transactions with patient information, and they have to send messages or communicate patient information. So you have to protect it in all its aspects.
Right. So when you send that patient information,
right,
that's hackable.
That is
hackable. You have to send it over some device.
Yeah, exactly. And that's where we come in. There's technology today that allows hospitals to send patient information securely, to be able to communicate it securely. The biggest problem is that if I don't know, number one, I have to identify who you are securely, and then I have to take your patient information and transport it securely. If we don't do that, then as a industry, healthcare will not be able to automate. And this is a huge problem in healthcare because they spent the last 10 years automating, digitizing all your information. No one worried about your file information when it was sitting in a file cabinet and someone had to actually break into the hospital, break into a door, and steal your file.
But what if it's on a laptop? What if the doctor takes the laptop home?
Well, actually, hospitals actually don't allow you to do that. Hospitals centralize your information in a server in the IT room, and the doctors get secure access to it from home or at the patient bedside. It's the same level of security.
I was just at my eye doctor, and he was typing everything in as the nurse was, and as I was going through the different tests on a laptop.
Fair enough. So clinicians in certain practices still do that. This is what we were talking about earlier. The market is not there yet.
Right.
A lot of people we're at the early stages. If you look at the financial industry, they're spending billions of dollars on security. Healthcare is way behind the 8 ball.
Isn't that interesting?
Yeah, so, you know, if healthcare companies should be spending on this and hospitals should be spending on this, what's the competition, so to speak, for the IT dollar here that you're working with? Well,
I think that, you know, in any industry, I don't care whether it's healthcare, first you invest to automate and digitize. When you do that, the next thing you face is that you are under attack. Cyber attacks, hacking, we've seen Anthem. You know, patient information sells for more expensive on the street than does a credit card information because it's not just your social security, it's your health records. Fraud is up. If I have your identity, I can go get treated somewhere.
Yes, so that's what I was going to say. What's the downside risk here? I mean, why do we need to make sure to protect this kind of data?
Both for privacy and safety. If someone gets your information and then goes in and gets treated under your name, you now have a medical record created somewhere, treated for the person that wasn't you.
Jesus.
And so imagine when you need to go back and get treated, by the way, you can't change anything because it's your medical record now. And if you got treated with the wrong medication, you could die.
How prevalent is this, though? Because we don't really hear about it. We hear about when Target has customer information stolen at Target, but we don't hear about people's health information being compromised?
It's a growing problem as healthcare starts to adopt technology. Security, and this is why you have HIPAA regulations. This is why you are starting to enforce, in the state of New York, actually, on the 27th of March, you're going to implement the iStop law, which means every electronic prescription has to be prescribed electronically. Imprivata has been working on solutions with the electronic record manufacturers because we have an opiate problem in America. 28,000 people die from drug overdose in this country. You can actually solve it with technology. But in order to solve it, I need to have better security in ways how I prescribe the medication. And New York is actually one of the pioneer states. Imprivata has been working with a bunch of different companies in the space. We developed a solution. New York University is using it today. It allows doctors to prescribe securely for you medication for what they call Class 3 narcotics.
Well, as long as it works better than what happened with Obamacare on the internet.
Oh. Good point. Omar, good to see you. Thanks so much.
Thanks a lot,
We'll be watching Omar Hussain.